Hello my dear student, Assalamu alaikum. I am Dr. Karime Rezwan Hasan, Associate Professor, Department of Anatomy of the Newszonebd Medical College. Welcome you back to the last session on bones presentation. Today we will discuss about a very important topic which is called ossification. By this time you already know that what is ossification. Ossification is the formation of bone. Now in our body the bones are formed by two processes. Intra-membranous ossification and intracartilaginous ossification. Intracartilaginous ossification again known as endochondral ossification. Now, if we go through the process of ossification, we will see that intracartilaginous ossification differs from the intramembranous ossification. In case of intracartilaginous ossification, there is usually a typical kind of cartilage model present initially. That cartilage model later on is replaced by the bones. Over here, the word replacement is very important. What is replacement? When anything is totally replaced by something new, that is called the replacement. That means the main thing will be totally abolished and the new thing will come into its place. Again, in case of intramembranous ossification, there is a membranous sheath and that membranous sheath is coming from the mesenchymal cells. Now this membranous sheath will be converted into bone. Here the word conversion is very important. Why conversion? Because over here the membranous sheath will be converted into a thick layer of bone. That means here nothing is replaced, only conversion or change is happening. Now let's see the definitions. Over here you can see the definition of ossification. It is the process of formation of bone. It begins usually at the 6th to 7th week of intrauterine life, except the clavicle. Usually clavicle appears at the 5th week. Now, in case of intracartilaginous ossification or endochondral ossification, we can see a cartilage model which is mainly formed by the hyaline cartilage is totally replaced by the bone. On the other hand, in case of intramembranous ossification, a membranous sheath which is mainly formed by the mesenchymal cell is totally converted into bone. So, the word replacement and conversion is very important over here. Now, let's see about the endochondral ossification. In a brief way, if you go through the endochondral ossification, initially there will be a cartilage model. That cartilage model is obviously covered by the perichondrium. You know the cartilage model is composed of chondrocytes and chondroblast. When there is appearance of the primary ossification center within the cartilage model, then the bone formation happens. How? The chondrocytes will be died by the hydropic degeneration, that is called the physiological death or apoptosis. That dead sites or chondrocytes will be engulfed by the macrophage and there will be formation of the primary areola. Later on, in this primary areola, blood vessel will appear and again osteoclast will appear along with the osteoprogenitor cells. Those osteoprogenitor cells will be converted into osteoblast and those osteoblasts will synthesize the organic bone matrix. From the blood vessels, calcium will appear as an inorganic bone matrix and bone formation will happen. At the same time, at the two ends, these secondary ossification center will appear along with the blood vessels. So again the bone formation will happen at the two ends and now these bones will be the spongy bones. You know osteoclastic cells are usually doing the resorption of bone. They engulf the bone. So they will maintain a cavity in the primary areola as a secondary areola and that will later form the bone marrow cavity. Let's see the process. So over here we can see a hyaline cartilage model appears which is formed by the mesenchymal cells. This cartilage model is covered with the perichondrium. Primary ossification center appears within the cartilage model. Due to the presence of primary areola or primary centers, chondroblast and the chondrocytes cell die by the process of hydropic degeneration or apoptosis. The dead cells are phagocytes by the macrophage and vacuolated space are formed which is called the primary areola. In this picture we can see mesenchymal cells are aggregated and it is forming the cartilage model, that is the hyaline cartilage model. Over here hydropic degeneration is happening within these chondrocytes. That means over here the primary ossification center is appearing. Later on a blood vessel is entering into it along with the periosteum and that periosteum is having the osteoprogenitor cells. That osteoprogenitor cells will be converted into osteoblast, and the osteoblast will synthesize the organic bone matrix. Over here we can see the bone formation is happening. At the same time, we can see that there is a vacuolated space over here, which is called the secondary areola or the marrow cavity, and this is done by the osteoclastic cell by the bone resorption. At the same time, we can see the thick bone is forming at the shaft. At the same time, the cavity is appearing as a bone marrow cavity. Some blood vessels will again entering into the two ends as a secondary ossification center. Bone formation happens in these places as well, and this way the total endochondral ossification happens. Now over here we can see the perichondrium is replaced by the periosteum, and the periosteal prolongation known as periosteal bud is formed along with the blood vessels that enters into the primary areola. Osteoprogenitor cells from the periosteal bud converted into osteoblast will synthesize the organic bone matrix and forms the Haversian system. Osteoclastic cell erode the wall of the primary areola, and the secondary areola or medullary cavity is formed. Now secondary ossification center will appear at the ends of the long bone, and with the presence of the blood vessels, specules of bones will be developed, and those bones are called spongy bone. In this picture we can see the same process. Over here we can see the blood vessel is entering and the bone formation is happening, and marrow cavity has appeared due to the osteoclastic activity. These are the Haversian system containing compact bone. Another vessels is entering into the ends, that is again forming the bones, but this time these bones are not compact, these are spongy bones. But most noticeable thing is there that we can see in a long bone there is articular cartilage and hyaline cartilage. These cartilages are mainly coming from the primitive cartilage model, as we can see, and these cartilage plate will appear at the time of development, and it will be persisting until and unless the bone is achieving its full growth. Now bone growth occurs in length at epiphyseal plate, and articular cartilage appears at ends. Red bone marrow is replaced by yellow bone marrow at the medullary cavity and persists at the ends and metaphysis region within the spongy bone. The bone growth occurs by the endochondral ossification. Now from these pictures we can easily understand that there are two cavities that is containing the bone marrow. One is the main bone marrow cavity that is present within the shaft. On the other hand, at the ends there are some specules of bones, and within them spongy bones are present, and the spongy bones are containing small cavities that is also containing bone marrow. In my previous class I have told you in the main marrow cavity that contains the yellow bone marrow. It is called yellow bone marrow just because it is having profuse amount of fat cells. But at the end of the long bones, the spongy part is containing the red bone marrow. Remember, red bone marrow is red just because it is containing profuse amount of RBCs, and the red bone marrow will produce the red cells and the other blood cells. But yellow bone marrow is mainly containing the fat, and that fat is a storehouse of fat. Now let's see what about the intramembranous ossification. In case of intramembranous ossification, there is actually the process what is actually happening within the flat bones. In case of flat bones, the intramembranous ossification happens. The name itself says that it is membranous. Why it is membranous? First of all, there will be a flat layer or thin layer of connective tissue, and that layer is formed by the mesenchymal cells. Later on, what happens? An ossification center will appear in this layer. When the ossification center appears, there will be aggregation of the osteoprogenitor cells, and osteoprogenitor cells will be converted into osteoblastic cells. You know, the osteoblastic cells will form the organic part of the bone matrix. Then this osteoblastic cell will form the organic bone matrix. At the other hand, when small minute blood vessels will appear in this flat layer, it will give the inorganic part, that is the calcium salts, and combinedly the organic part and the inorganic part will form the bones. And this process is happening layer after layer as a lamina, and ultimately a thick layer of bone is forming. Now, what is actually happening? Interestingly, the thick layer is forming into two tables, outer table and the inner table. And in between these two tables, there will be a trabecular part or the spongy part. You know the morphology of the flat bones, outer and inner table of compact bone and intervening spongy bone. So that will happen over here. The process is not that much complex, but over here the important thing is that there will be three layers, outer and inner table of compact bone and intervening spongy bone. Let's see the process. Usually, in case of intramembranous ossification, flat bones are formed, and this process is happening by the process of apposition. First, proliferation and condensation of the mesenchymal cells happen. Formation of the mesenchymal sheath, which contains the osteoprogenitor cells, and connective tissue will appear. Appearance of the ossification center and formation of the osteoblast from the osteoprogenitor cell, as I said. Osteoblastic cell will synthesize the organic bone matrix, and deposition of the organic matrix occur over this sheath. Calcium deposits within the organic matrix and calcification happens. In this picture, we can see mesenchymal cells are aggregated, and we can also see the connective tissue cells that is containing the collagen fibers, and there is appearance of the ossification center. Now, there is appearance of the osteoblastic cells. Those osteoblastic cells will form the osteocytes. At the same time, osteoblastic cell will synthesize the organic part of the bone matrix. There will be appearance of the blood vessels that will give the inorganic part or the calcium. Ultimately, the thick bone will form at the two table, outer and inner table, and in between them there will be a trabeculated spongy part that is containing the blood vessels. Ultimately, the final organization will happen like osteoblastic cells will be arranged in two layers containing the thick bone and intervening spongy bone. And ultimately, those two layers are covered by the periosteum. Now, layers of calcified bones matrix are added by layers which are called the lamina. Formation of inner and outer table of compact bone and intervening spongy bone will appear, which are called trabeculae. Development of periosteum at the outer surface of the bone happens, and rebouldering of the bone is done by the osteoclast. In this picture, we can see the same process. Now let's see what are the factors that is influencing the bone growth. We know that for the proper development, the bone growth is important. There are several factors that is actually helping for the bone growth. Some of the factors are dietary factors and some of the factors are hormonal factors. Now let's see what are the minerals that is helping for the bone growth. There are certain minerals that is helping for the bone growth like calcium, phosphorus, fluoride, magnesium, iron and the manganese. Some of the vitamins are playing important role for the bone growth. For example, in case of vitamin C, the collagen synthesis and differentiation of the osteoblast to osteocyte happens. So vitamin C, which is one of the antioxidant vitamin, it is helping for the growth of the bones. Now, vitamin D. Everybody knows that vitamin D plays a very important role for the bone formation. So, vitamin D is essential for the absorption of calcium from the gut and the kidneys. Calcium will form the bones. Now, vitamin A. Vitamin A controls the activity, distribution and the coordination of the osteoblastic cell and the osteocytes. So, A, C, D, these three vitamins playing important role for the development of the bone. Now, there are certain hormones that plays important role for the bone formation. Insulin-like growth factor, this is one of the most important hormone. It promotes cell division at epiphyseal plate and also differentiation of the periosteum. Human growth hormone, that is also known as the growth hormone. This human growth hormone stimulates the production of the insulin-like growth factor. So ultimately, insulin-like growth factor and the growth hormone incorporating with each other for the development of the bone. Now, sex steroid. You know, in case of male, the sex steroid is testosterone. In case of female, it is estrogen. So, sex steroid can cause growth sprout through the increased osteoblastic activity. That means it will help for the enhancement of the growth of the bone. Now, at the same time, it also causes the shutting down of the growth at the epiphyseal plate. So, after certain age, this sex steroid will shut the bone growth as well. So, it is working in two ways. It increases the growth of the bone up to certain age, and after that age it will stop the growth. Then thyrocalcitonin or calcitonin. You know that thyrocalcitonin or calcitonin, it decreases the osteoclastic activity and increase osteoblastic activity and causes less blood calcium. The opposite thing will be done by the parathyroid hormone. How they are doing it? 3 major sites for their activities. How? You know that thyrocalcitonin, it works on the bone. What it will do? It will increase the osteoblastic activity. How it will help? The osteoblast will deposit calcium more on the bones, and thus it will decrease the blood calcium level. It will cause the less calcium absorption through the kidney. It will cause the less calcium absorption through the intestine. Ultimately, the blood calcium level will fall. But the total opposite thing will happen in case of parathyroid hormone. It will increase calcium absorption in the intestine. It will decrease calcium loss through the kidney. It will increase the osteoclastic activity in the bone, and ultimately the blood calcium level will increase. So, both of these hormones are doing totally opposite effect in the calcium metabolism. In this picture, we can see that from the thyroid gland, thyrocalcitonin is appearing, which is actually decreasing the blood calcium level. On the other hand, there are 4 parathyroid glands which are releasing parathyroid hormone, and it will increase the blood calcium level by the osteoclastic activity, where the thyrocalcitonin is actually increasing the osteoblastic activity. Now, there are other factors that affecting the bone growth. Some genetic factor. Some genetic disorder also impairs the bone growth, like chondrodystrophia fetalis, a autosomal dominant disorder that causes impaired bone growth due to failure of the endochondral ossification. Very rare disease, but it is an autosomal dominant disease. Now, some mechanical factor. Some of the people say that the more you hump and jump, the more you do the physical activities, your bone growth will enhance. Even some of the parents also suggest their kids, like, do some physical work, do some play, do some sports, so that you will achieve your full growth. Yes, some of the mechanical factors and the compressive force also causes the changes in the bone growth. Tensile force helps in the bone growth. That means when you are doing some kind of sports, gymnasium, that will increase your bone growth if you are in the developing age. At the same time, compressive force, that is, if you are having some of the exercise, that is weightlifting in the very early age, that can decrease the bone growth, because compressive force always decrease the activities of the epiphyseal plate, and ultimately the bone growth will not be achieved that much. So these are the factors that affecting the bone growth. So that is all about our today's presentation. You know that we have finished the bone and we have already completed 4 presentation on the bones, and today was the last presentation. Hopefully you will get all the information that is needed regarding the bones, the general anatomy of the bones. Hopefully in the coming days we will discuss about the cartilages. Till then, stay safe and be safe. Take care.